Zepbound 15 mils, and so far I've lost 35 pounds. Are you on 15 milligrams, or tell me a little bit more about the dose that you're actually on? Yeah, insulin resistance. I try to stress this, like, this point over and over and over. You gotta fix insulin resistance. You gotta fix insulin resistance. You gotta fix, hyperinsulinemia without a doubt. Yeah, 15 milligrams is a maxed out dose. Like, that's an issue. Being on the larger dose, being on that maxed out dose, I've seen so many issues happen from that. It's almost as if there's a resistance to the medication that develops, and so we can absolutely help you out with that. Um, how many else how many other individuals watching this live right now are currently on, like, above 10 milligrams of tirzepatide or above 1.5 of semaglutide? Uh, welcome, welcome. Laura, I've lost 9 pounds in 10 weeks. I've started 10 units and now I'm on 30. Should I increase? Always, Laura, stay on the lowest dose possible. The lowest dose is the best dose, guys. I will always stress this as much as I possibly can. The lowest dose is the best dose. And you don't need to continue to increase. You just got to focus on incorporating lifestyle interventions. That's it. Just a little lifestyle. Doesn't have to be too crazy. Doesn't have to be too overbearing. But you're gonna have to do some work. You're gonna have to get your feet wet, guys. There's just no way around it. But I got you. I got you covered. I'll make it easy. I'll tell you the best thing you can do. Uh, Fixing the insulin resistance is through a combination of lifestyle interventions. We fix the insulin resistance with the combination of lifestyle interventions. So I see a lot of people. Thank you, Chi Chi. 2.5 milligrams, 2.4 of semaglutide. Alex has been on 15 milligrams since November. User was on 15, back down to 10, increased protein. That's good. Zepbound 15 milligrams, lost. How do I maintain now? So there's two different problems here, trying to maintain your weight loss after your goal or just not being stuck on a larger dose. And collectively, we are talking about some of the same issues. Uh, you have to improve your insulin resistance. How do you do that? Right? How do we accomplish this? And this is there's many moving pieces to this. And a lot of people might bring up, so Susie is asking about natural GLP-1 medications. Hey, Holly, good to see you. I sent you a message, Holly, by the way. Uh, Looking forward to talking to you about that. It was a really cool article that you had sent over. Um, so natural GLP-1 solutions, guys. Please don't ever fall victim of a supplement company telling you that a natural GLP-1 product is going to provide any sort of appetite suppressant that's going to parallel the GLP-1 medications. It's just not going to happen. Like it really isn't going to happen. And so I know that's frustrating because many of these companies will market and talk about these supplements like a viable solution, but it's not. And I will always say this over and over and over. If you can make the changes uh, without the medications, then don't use the medications, right? I'll say that over and over and over. But I think many of you, unfortunately, are going to need something stronger and something more aggressive. That's without a doubt. I will definitely say that. Hey, John, what's up, buddy? How are you? Aaliyah, hello, hello. John, rest is for the weak, buddy. Um, so Retatrutide is definitely a nice peptide to consider, and we do have 503A quality retatrutide, guys. Um, if you're thinking about using retatrutide, I would strongly encourage you to make sure that you are looking at the big picture and or incorporating as much lifestyle as we possibly can. Yeah, I mean, you look whether you inject every 5 days, every 7 days, or, twice a week, it really doesn't matter per se. I do think some people benefit from injecting, more frequently at a lower dose. So at the end of the day, it just comes down to what your average dose is per week. That's what you're looking at. Hey, Susie, welcome, welcome. Yeah, so we promote the proper and safe usage of medication. Um, I think that most people are going to need them. I when you're looking at obesity and you're looking at these more severe metabolic health issues. Hey, Labrat, thank you so much. Guys, if you just joined us here, welcome, welcome. So, my name is Dr. Jones. I have clinics we service across the nation, all 50 states, and we specialize in helping people achieve sustainable weight loss utilizing lower doses of the GLP-1s, powerful peptides, and key lifestyle interventions. And so these GLP-1s are amazing, but they're not being used correctly. They're not being promoted correctly. I think there's a lot of misinformation around these medications without a doubt. So how do we use them correctly? How do we get set up for success long term? That's what we are constantly advocating for and teaching our community. So do me a big favor, introduce yourself, let me know where you're watching from and currently how's it going for you? What sort of struggles are you running into? Lisa, point 0.5 below Ozempic, I lost 1 pound per week. All right, that's a great start. How much do you currently weigh? And what is the total amount of weight that you need to lose? I have type 2 diabetes. I'm on 15 milligrams of Monjaro. I was taking once a day insulin. So that's a fantastic improvement. If you've been able to get off of the insulin, that's definitely an improvement. So I'm very happy to hear that. I've been on tirzepatide for 7 months, no weight loss, pre-diabetic. Should I try retatrutide? Uh, I think you should try some guided approach. I think you should reach out to us and let us work with you so that we can optimize what you're doing. Yes, maybe adding other peptides, adding retatrutide, some of these things might help, but ultimately, setting you up for long-term success, I think, is the most powerful thing and the most important thing that you can do long term. Leanna just started tirzepatide yesterday. That's great. That's awesome. What's the overall plan for success long term? What are we looking to accomplish here? I started walking 30 minutes a day, watching my carbs. Love it, love it. Decreasing your consumption of carbohydrates, I think, is one of the quickest ways and most direct paths that you can take towards triggering weight loss and improving metabolic health. So kudos to you. That's awesome. There we go. Um, Sparkles. Have I heard of 5 amino 1MQ? Oh, thank you, Sparkles. Yeah, Heather's awesome. I'm glad that you guys are in contact. Um, 5 amino is cool. It's definitely an option. Uh, we really brought it in as an alternative to AOD when we thought AOD was going to go somewhere, but we're fine. AOD is not going anywhere. And AOD is still my favorite option, my favorite peptide to stack with the GLP-1, without a doubt. That's great. That's great that you're fasting. Yeah, 16 to 19 hours a day. I actually prefer uh, that you do more of an 8-hour eating window, but then once a week we get you into the flow fast. Um, the flow fast is really where the magic happens. That's where we that's where we would reduce the amount of insulin resistance that you have, because the longer fast is really how you get into the healing. Chi, I don't think you've reached your limit. I just think that you need help. I think that you have a lot more weight that you potentially and absolutely could lose, but you need to work with some professionals so that we can help dial it in. That's great, Matt. Yeah, we definitely notice collectively AOD better, but no, if you think you're getting better results with 5 amino 1 M2, that's totally cool. Aaliyah, so my idea is that if I do a 48-hour fast once a week, then I wouldn't need the peptides. No, the idea is both, Aaliyah. So, um, you know, the long fasting, the flow fasting is how you fix your insulin resistance, and the peptides, it all works synergistically. So the peptides, the GLP-1s are going to make it easier. The AOD is going to make it easier, enhance your results, to protect your muscle mass. So putting it all together for you in a program is kind of like the big picture of what we're doing. Can you stack the five? Yeah, I don't see an issue at all. I don't think you need all that, Sparkles, but you could. How long you think it would take to bring an A1C down to less than 5? Marcella, I mean, nobody could answer that question because it would depend on how sick your body is, and how high your current blood sugar is, and how aggressive you are going to be about implementing the changes, right? There's so many different changes. There's so many different things that I might recommend. I'm gonna try something here, guys. If you wouldn't mind, I'm gonna hop off and I'm gonna hop back on the live. So I will restart here in a second, and I'll see you guys here in a second. Aaliyah, I'm glad you got to connect with Adrian. She understands my program very well, and yeah, she understands what we're doing. So that's cool that you guys got to connect. Um, GLP-1 has given me a solution for feeling for the first time in my life. Do I have to continue this? So, Linda, I think ultimately that's going to depend on the big picture. So, the question is, guys, do I need to stay on the medication? Do you need to stay on the GLP-1 medication for the rest of your life? I think that's going to differ person to person. How's your fasting? How's your weight training? How's your supplements? Um, what changes are you making on the big picture? And the more changes that we make, I think the more independence you will ultimately be able to build long term. So I think that matters the most. Let's see. Linda, does that make sense? Does that answer your question? Welcome, welcome everybody. King's Dad, I was taking 7.5 of TERS, which was 75 units. I was prescribed 10, which I thought was 100. I mean, if your concentration is 10 milligrams per ml, then yeah, that math would make sense. 100 units would be 10 mLs, would be 10 milligrams. I should have been taking 50. Well, King's Dad, that's not the end of the world. You understand now what you need to do. You understand your correct dosing, and I think that's okay. Guys, if you just joined us, welcome, welcome. So, my name is Dr. Jones. I have clinics. We service across the nation, all 50 states. I work with my medical practitioners. They prescribe and I coach. So, my medical practitioners do the prescriptions and I do the coaching. We prescribe semaglutide, tirzepatide, retatrutide. We do all the different tides, all the different GLP-1s, and then we pair it up with my lifestyle coaching. So, helping you guys achieve the highest level of health by implementing targeted lifestyle interventions that you can actually adhere to, that you can actually sustain for the rest of your life. That is really what we specialize in, and that's what people reach out to us for every single day. Tailoring a program for you, starting off with comprehensive labs, testing for insulin resistance, inflammation, and various health issues so that we can target an ideal path, like an optimal path. Yeah, I think many of you guys get stuck and you're not sure exactly, what to do, where to go, how to approach this. And this is what we do every single day. So let me know in the comments right now, what are you struggling with on your journey, or are things going well? If they're going great, let me know too as well. We can chit chat about weight loss stalls. We can chat about inflammation issues, insulin resistance. Asabo, hello, hello there. Uh, Linda, I'm looking for food causing satiation. Satiation? Is that what you're saying? Um, so basically, are you saying you're looking for something to handle your cravings and your food chatter? Is that right, Linda? I just want to make sure I understand. Um, Hunted bathtub. I'm on 2 milligrams of Retta weekly. Suggestions doesn't last all week. Well, many people are splitting their weekly doses of their retatrutide a couple times a week. And that definitely would probably solve your problem and give you a more even distribution of suppression. Asaba, you know, this program isn't for everybody. Uh, we are tailoring an individual program for you so that you can achieve the desired outcome, which is lasting weight loss, permanent weight maintenance, having the ability to work with me directly and my medical team, and not having to go constantly back and forth with the yo-yo. This is why people reach out to us every single day. So I definitely am looking forward to working with you, Asaba, and definitely think this is the right path for you if you're looking for that level of service. Of course, there's plenty of other options out there for just kind of like taking the medication and rolling through it like that. That's definitely other options out there. Hey, Yan John, if you're looking to try GLP-1s, guys, if you're looking to do this correctly, if you want guidance, coaching, support, shoot us a message right here. All you got to do is text us with your name and your email and get yourself scheduled for that consultation, guys. My team uh, will go over the whole big picture, get to know you, and help you establish a bit of a plan on how you can approach this. Giselle, I've been on Ozempic since the 30th. Oh, let me fix the number here on my shirt. Thank you for letting me know. You guys see that better? This is the number to reach out to us. Kelly, hopefully you can see that better now. BN 1215. Do you see a problem with taking TRT and tirzepatide together? Not at all. Not at all. They're completely different solutions to completely different problems. But if you need testosterone, if you need TRT, it's phenomenal. I mean, symptoms of low testosterone are, um, brain fog, tiredness, lower libido, lower motivation, maybe increased anxiety, depression, feeling like you're not keeping your gains or responding to the workouts. Those are all different scenarios of what it would feel like to be on suboptimal testosterone. Jasmine, so I've been helping people for in the weight loss space for almost 20 years now, uh, managing multiple gyms with thousands of personal trainers beneath me, constructing the programs for the clients. Then I became a doctor of chiropractic, and then for the last 10 years working with medical providers. So in my clinic, you'd be working with my medical providers and you'd be working with me and my team of coaches. So it's like two different departments working together to make sure you get the best results. So they'll focus on the prescriptions. Like I said, we do the GLP-1, semaglutide, tirzepatide, retatrutide. We have powerful peptides like AOD 9604. And then we also have the hormone therapies, the autoimmune supports. We do have 503 retatrutide, just so you guys know. How do we know which compounding pharmacies are trustworthy? So if you're getting them from a clinic like ours, where the physician is prescribing for you, uh, and they're being shipped to your doorstep, that's what we call 503A quality peptides. And so these peptides are just, it's a whole nother level of scrutiny, and the standards and safety are significantly higher. And so you know what you're getting, you know it's safe. And then of course we're coaching you um, to make sure that you're doing the right thing, that you're taking the right protocol, you're doing the right lifestyle alongside with it. What's the coaching include, Aaron? Yeah, so the coaching is, we have multiple different tiers of coaching just so that you can think with. But um, the warrior coaching, which is my favorite level of coaching, which I would love to see you guys embark on. We start with a comprehensive blood panel. We're testing for insulin resistance, inflammation. Um, we do a functional thyroid panel because it's a lot of people are clinically suboptimal or low with their thyroid. Um, and then we're looking at, of course, your metabolic stuff, your A1C, insulin resistance, which is fasting insulin and C peptide. So it's a really comprehensive panel, Aaron. And then you have your medical call and medical evaluation, and then you're working with me on my coaching. So we start off on a Zoom call where we dig deep after you finish your coursework. There's a course for you to go through, like an onboarding course, and then you hop on a Zoom with me. And then I'm checking in with you on a more intimate level on a monthly basis. I have weekly group calls. And so there's a lot of different levels of support with that warrior program. It does give a guarantee of results. So I will continue to work with you after that time period if you don't lose at least 1% of your body weight every single week. If you're not getting the improvements that we lay out, then we just keep working with you. So I have a very high level of success with that warrior program. Schools, the coaching with me is live. It's not pre-recorded. We have the small group coaching, the large group coaching. Of course, you have options to access the recordings and everything. But yeah, everything we do is live. Yeah, you're welcome, Aaron. How's your journey going so far, Aaron? What are you currently stuck? Are you running into any issues? They can go over the prices of retatrutide with you during that consultation. They'll go over the prices of the retatrutide, the coaching, the lab work, and all of that stuff. What if you're maxed out on your weight loss? Uh, there's no such thing as being maxed out on weight loss. It just means that you don't know what to do next. And so we're going to work with you to help you fix that. Usually a reset is needed, a metabolic reset or a medication reset, get you back on track and then get you rolling more so afterwards. A man on retatrutide. I'm on week 2 of 5.5 of Reta, and tomorrow is week 3. Should I stay on point 0.5? Point 0.5 milligrams of retatrutide is really low. So I can't give you medical advice or, tell you to increase or anything like that. But yeah, point 0.5 per week is pretty low. Usually starter doses of retatrutide are more in that 1 milligram level. Usually, John, we recommend AOD the same way. We recommend AOD to be taken in that same fashion. Will Ozempic help with microcondylar cirrhosis? I'm not sure what you're saying. Rack, I'm sorry. So liver cirrhosis, I mean, it non-alcoholic fatty liver disease, absolutely. Very, very beneficial for helping to reverse that. But once your liver has cirrhosis. Generally, the cirrhosis is usually understood as non-reversible in most cases. Angel says, I just had a consultation. She's an absolute doll, and I'm looking forward to doing 6 months with you guys. That's fantastic. You probably met with, did you meet with Nicole or did you meet with Desiree? Is AOD Tessa a good mix? It might be. It totally might be. It just depends a little bit more. Like I need more context, more details about what you're struggling with and what's going on. Guys, if you just joined us, welcome, welcome. My name is Dr. Jones. I have clinics we service across the nation, all 50 states, teaching you guys the secrets, teaching you guys how to stay safe is what it's all about here today. So we can chit chat about um, weight loss stalls, slow results, no results. Marcella has a consult with us today at 5:30. That's awesome. Excited for you, Marcella. You're going to work with you're going to talk to one of my experts and they're going to get all your questions answered. And so yeah, I think let's rock and roll. You know what I mean? Like let's do this. Um as you guys join us, be sure to introduce yourself and let me know a little bit more about kind of what's going on. What are you struggling with? We do service all 50 states, just so you know, and we do provide a guarantee of results working with various obese, diabetic, metabolic health, autoimmune conditions. Dave, you have a consult with us tomorrow. Fantastic, Dave. Let's kick some butt. I'm excited for you, my man. This number right here is actually the best number to reach out to my team in case you guys are curious. Aaron, I just had a hip replacement a week ago, had been on a trial peptide for 1 month prior, 2 months, no sugar, low carb. Um, gotcha. I've been on a tripeptide. I'm not sure what you mean by the tripeptide, but how could I possibly help you, Aaron? User 408 in my first week of Retta did 2.5 milligrams down 7 pounds. Too much. Yeah, 7 pounds in a week is absolutely too much. That is way too fast. But if you just started, that's probably a lot of water weight. But if you keep losing that quickly, I would be very concerned. Not sure who told you to start off with 2.5 milligrams of retatrutide. That's not a good idea. I'm glad that you're not in the hospital and I'm glad you're safe, but that was very ridiculously silly advice. Who told you to do that? Not a good idea. No bueno. Cheryl, I'm on Ozempic, elevated enzymes. I'm at goal on 2 milligrams. 2 milligrams of semaglutide, Cheryl, and elevated liver enzymes. So let's fix up your liver. Let's fix up your health. There's a lot of things we can do to help you out with that, Cheryl. Nova, going on week 4 of semaglutide, having flare up from diverticulitis. Heard of anybody on antibiotics? Yes, I've worked with people on that have diverticulitis, but no, not necessarily caused by the GLP-1s, but you know, existing gut health issues can be exacerbated by the medications, and this is why we want to look at the big picture. Gut health, autoimmune issues are extremely important to address. Thank you, Angel. I appreciate that. I like to say that I says it like it is. I try to just be as real and authentic as I possibly can because I ain't got any time to do anything else. Yeah, Cheryl, that doesn't sound good. I'm definitely concerned about that, and hopefully we can get a chance to work together and try to figure this out. On Instagram, score Piamiali, hi from Germany, been on Monjaro for 28 weeks, lost 33 kilos, and now my problem is that I'm losing weight but less fat. I have insulin resistance. So welcome and hail from Germany. That's awesome. What time is it over there in Germany? I wonder if it's morning or what time it is. We have to fix your insulin resistance. That's the bottom line. Score. You can join my coaching program from the being in Germany, but we just couldn't prescribe anything to you. Carol, hailing from Chicago on Monjaro for almost a year, 60 pounds down. So far on 7.5, 6 months weight loss has stalled. Working with the trainer, Carol. Yeah, we have a whole program to actually help you fix that stall. So a weight loss stall, usually on GLP-1 medications, it's triggered by not eating enough food. So you're not eating enough food, you're not getting enough calories, you're not getting enough nutrition into the body. So usually that's what's creating the issue. Is Retta available? Yes. Uh, Fabian, we do have 503A quality retatrutide. And so I would shoot us a text message, get yourself scheduled for that consultation. Yeah, everybody needs a reality check sometimes, for real. The lowest I can get is 140. This morning, 141. I'm so sick of it. Chi Chi, when are you going to reach out and get yourself scheduled so that we can end the frustration, so that we can end the vicious cycle and set you up for success long term? I would love to see that. I would love to work with you. Thoughts on cagrilintide for appetite suppression? Cagri, we do offer as well. From what I can tell, it packs quite a punch. Um, Thoughts for user 408. When you start at a higher dose, you risk complications, side effects, stressing your body out, and you're developing a tolerance faster than you need to. So, it's just not the ideal way to go about that. Perla recently broke your 2-month stall. Love it, love it. I love that you're doing that. That's freaking awesome. Katrine, 138 to 124. Gotcha. So you're stalled on 1 milligram. How many people watching this are in a weight loss stall? Because maybe we'll train on that first. Do you guys want me to train on weight loss stall, a solution for the weight loss stall? We can talk about that first. Casey, trying to get a link for your membership. Do I have to call? No, you can shoot us a text message, Casey, and we can send you that link. Yeah, we can send you that direct link. Not a problem. Shoot us a message here, and we will send you the direct link. All right, so the weight loss stall topic is what everybody wants to chat about. Let me answer Adam's question here on YouTube. What's the main difference between Flow Student and Flow Warrior? The main difference between my two coaching tiers is the level of access you will have to me. On the Warrior, we get monthly intimate check-in calls where I get to hop on the Zoom with you. We get to really dive into what's going on and have that conversation, optimize and tailor whatever we need to. Also, the Warrior comes with the guarantee of results. So that's the big difference. The student, you still have unlimited access to my main coach. Her name is Ceci. She's amazing. In both tiers, you get access to my group weekly coaching calls as well. Those are the main differences. Okay, so let's talk GLP-1 weight loss stalls, guys. This is absolutely a massive problem that, yes, user 408, we work with people from all 50 states. So if you guys are curious, you want to know how to reach out to us, how to get scheduled, this number right here is actually the best number, the easiest number. Reach out to my team, just text us. They'll respond, they'll get you scheduled, and we'll rock and roll. We will rock and roll, guys. Okay. So the quick answer that you're looking for, why did my results slow down? Your results slow down because you underate over a long enough period of time. You entered starvation mode. You entered metabolic downregulation because you weren't getting enough calories. You weren't getting enough macro and micronutrients. Your body goes into starvation mode. Now, why did this happen? This is such an important phenomena that I think not enough people are talking about. So I want you guys to kind of think about when you first started the GLP-1 medication. You guys remember this. You remember you started what, 3 months ago, 6 months ago, a year or two. And you remember when that medication first hit, right? You're like, holy crap, the food chatter is reduced. It was a big deal, right? How many years prior to you finally getting some relief from food chatter were you struggling with food chatter? 5 years, 10 years, 20 years, your entire life? How many years were you struggling with food chatter before you finally got to feel what it's like to not have it? Let me know in the comments because I'm number one, I'm genuinely curious, but number two, you're going to understand why I'm asking here in a couple minutes. How long were you struggling for, and what a difference did it make when the dose finally hit? So Fabian says 20 plus years, Ed says 30 years, Mary says 25 years. Lisa says, I just went to my eye doctor to follow up and my sight is improved. So it has to be the Wegovy over the last 3 months. Look, all this concern and fright over blindness, this is ridiculous. Most people, I would argue, would likely get better vision, not blindness, because of what the medication's doing. The medication is massively lowering insulin levels. It's reducing blood pressure. Most importantly, it's suppressing your appetite. So Virginia says 38 years. We got 14 years, 45 years. Inflammation has improved. This is a big deal, right? So your life completely changes. Like, I get it. I'm with you. I understand what you're talking about. But this is exactly my point. Okay, here we go. You ready for it? After 20 years of not being able to control your eating, not being able specifically to stop eating or not eat when your body wanted to eat, right? Your body wants to eat. Mentally, you said no, you would always lose that battle. Now the medication creates the opposite scenario. It works so well that you literally struggle to eat. Think about that. For 20 freaking years, you couldn't control your body. Now your body is controlling you in the flow of you're struggling to eat. You have to remember to eat. You have to tell yourself to go eat because your appetite is too suppressed. It's too zonked. There's no coaching, guidance, structure, or support. And so you're struggling, especially when you buy the freaking peptides and GLP-1s online. Don't get me started with that. Guys, please be safe out there. You don't want to be doing this stuff online. You don't want to be uh, injecting God knows what into your body. Like, please, please, please be safe. Thank you, Andy. I appreciate that. And honestly, guys, I understand this because I'm with you. Like, I've struggled with this issue my entire life. I was an obese 16-year-old child that couldn't do a single push-up because I was so obese. And you guys, most of you guys know my story. So, but I need you guys to understand the mindset here because you have to be the one that takes control of the situation. You're struggling right now. You're in a weight loss plateau. And now you have a little bit of a backstory to understand where it came from. So we got enough of that. Like we got enough of an understanding of where the stall comes from. Let's talk about part two. I'm gonna break this into 4 different parts, just so you guys know. I'm gonna talk about 4 different categories. We just talked about why the stall is happening. That was part 1. Part 2, we're gonna talk about the science of the weight loss stall. I call it zombie mode, right? Why do I call it zombie mode? Because you're tired, you're brain foggy, you're constipated, you're feeling cold. There was at least 10 of you guys that told me earlier you're in a weight loss stall. Are you guys also struggling with these symptoms as well? Let me know in the comments which symptoms you have. Tiredness, brain fog, constipation, feeling cold, achy body, feeling just kind of cloudy. Let me know which one of those symptoms you're also struggling with so that everybody else can see that it's not just them. You're not crazy, but this is a very common thing that happens. This is what happens when you mess with your thyroid function. Is carnivore diet safe with GLP-1? I would say so. Is there research done on the safety of doing carnivore and GLP-1? No. Will that research ever be done? Probably no. Do you need research on carnivore and GLP-1? No. Many people will say, don't eat a high-fat diet. That's right, guys. Don't eat a high-fat diet. You should eat a high-carb diet. That's what's good for you. Don't eat the fat, eat the carbs. Because remember, you can't have a low-fat, low-carb diet. If you have a low-fat and a low-carb diet, that means you're starving because you're not going to eat enough protein. There's only 3 sources of calories: carbohydrates, protein, and fat. And so if you go low carb, you have to go high fat. That's the inevitable result. There's not enough protein to get enough calories. So Carol says all of the above: bloating, constipation, the high ice cream diet. Yeah, the ice cream diet. Yes. What do you guys know about that ice cream diet? Guided Push says that must not be working for you, by the way. Thyroid, is that okay? So if you are missing a thyroid, that does not rule you out or create any sort of contraindication for you with GLP-1 medications. So understand that the only contraindication, the only thing to worry about with, like, you think about thyroid and GLP-1s, would specifically be a family history of thyroid medullary cancers. 5 weeks. Glam is saying 5 weeks into GLP-1, 2.5, and I'm not losing any weight. I am ketogenic. That's fantastic that you're on a ketogenic diet, Glam, but something else is going on. It could be thyroid, it could be inflammation, it could be cortisol. You should pay attention to what I'm talking about right now because we're getting into it. We're talking about thyroid function. King's Dad says, all I can say is thank you. Your information is so valuable. Thank you, King's Dad. I appreciate what you're saying. Definitely keeps me motivated to help you guys out as much as I possibly can. So the thyroid is extremely important. Think of the thyroid like your master hormone. There's trillions of cells in your body, and there's thyroid receptors over all of them. And so when your body goes into starvation mode, metabolic downregulation, the thyroid function decreases. So if you guys ever looked at a chart of low thyroid symptoms, if you guys ever heard of hypothyroidism, you notice that starvation mode and hypothyroidism, they overlap. They look very similar. For the short-term effect, they are similar. They're basically the same thing as far as what you're feeling, but they're very different because you don't need medication, thyroid medication, to fix starvation mode. You just need to eat more food. And we're going to talk about that in part 3. Yes, Robert, potentially I can't give you medical advice, but potentially some people would benefit from stacking both of those. Of course, if you're working with us, we can stack those, show you how to stack them safely. Remember, guys, we want to keep you on the lowest doses possible of your GLP-1 medications, your peptides. We want to encourage massive change to your diet, massive change to your lifestyle that you can sustain for the rest of your life. Lisa, having Graves' disease, losing your thyroid at 17, downhill since then. Well, I'm so sorry, Lisa. The medical community really sucks when it comes to managing autoimmune issues and autoimmunity in general. They suck with insulin resistance. They suck with thyroid. I mean, there's a lot of issues. And that's why we do such a comprehensive blood panel in the beginning so that we can help you guys, get to the root cause. Melissa, you can actually get 503A quality retatrutide through us. Yeah, you guys can get 503A quality retatrutide. Just shoot us a message here, guys, and get scheduled for that consultation. Let's help you kick some ass. What does 503A mean? 503A means that it comes from a state licensed and federally regulated compounding pharmacy. It requires doctor prescription. And so you know what you're getting. It's safe and it's of high quality. And then, of course, if you're working with us, we're doing labs. You're getting the coaching, the guidance. And yeah, we're going to make sure you do this right. Do you know when AOD is getting banned? AOD is not getting banned, Taylor. As far as I know, AOD is not going anywhere. Yeah, AOD is here to stay. It's awesome. So we talked about why the weight loss stall happens. And we also talked a little bit about the thyroid, the impact to your thyroid, and why you develop these symptoms when you're in zombie mode, metabolic downregulation, why it's a survival response. Does anybody have any questions before I talk about the reset or the reverse diet, which is how you fix it? I want to make sure and cover any questions about, again, why it's happening, what's happening in the body. Basically, Kayla, in a nutshell, you're in a stall. Hey, Chris and Dean, how are you? Because you've been under eating over a period of time that was long enough for your body to trigger this response. And part of why you've been under eating is because the medication suppresses your appetite so much, and you're not thinking, no one's coaching you, no one's reminding you to make sure that you eat enough food. So experiencing a GLP-1 weight loss stall is very, very common. Very, very common. Kev, if you're in Scotland, you can still join my coaching programs. You can still join my community. Does retatrutide have more side effects and risks than tirzepatide? I don't think so, but because tirzepatide is past phase 3 clinical trial, you have to say that tirzepatide is safer than retatrutide. Even though I think retatrutide appears to be a legitimate option, I do think that you always have to go with the phase 2 clinical, or with anything that's been FDA approved and gone through phase 3. But we keep people on low doses of Reta as an option when they're not responding to the tirzepatide. Heart palpitations are a risk, are definitely a concern or a risk. And so a little bit more so with the retatrutide. So if you have any prior heart palpitations, supraventricular AFib, or anything like that, you probably should stay away from the retatrutide. I would not worry about vision loss, coffee king. I think that's grossly over exaggerated. Um, would I book a discovery call? No, there's a link, Kev, since you're in Scotland. There's a link where you can look at the different coaching programs and just purchase yourself and get started and get onboarded with me. So shoot us a message here and we can send you the international coaching link. User 793, thank you so much. I really, really appreciate that message. And I hope it was helpful for you. I really do, guys. I do my best to try to help you guys out as much as I can, even if you're not able to work with us. There's a wealth of free resources that we have for you guys. Make sure you follow me on YouTube. Make sure you're following me and listening to my various podcasts that we have. There's new episodes coming out every week. Chris and Dean, I'm pushing calories but gaining a lot on AOD and fasting. So, Chris, obviously you're in my warrior program, so you're working with me and Ceci. So within that, within the flow hotline, we should and working with her, if she needs to get me involved, she will. But you absolutely should not be gaining weight if you're not in a reset. So if you're not working with Ceci, then shoot her a text message and let her start her process of debugging and figuring out what's going on. And then if she needs to get me involved, then she'll get me on a call with you too as well. So now if you are in a reset, then that's sometimes part of the process, but you should still be letting us know. Taylor, PCOS is definitely a struggle. We do have a ton of success working with PCOS cases. With PCOS, we're dealing with heavy insulin resistance and heavy amounts of inflammation. So the PCOS is honestly treated no differently than any other person with very poor metabolic health. And obviously, we don't want to put you on testosterone. We don't need to do that. You have enough androgens in your body, but we focus on fasting, on keto and or carnivore, burning up those carbs in your body as much as we can. AOD is a fragment of human growth hormone. So AOD is a fat mobilizing peptide that we like to stack in combo with the GLP-1. It produces a really enhanced result. So you protect your muscle and you burn more fat. Salpa down 70, taking Zepbound in a stall, looking for your words of wisdom. Well, Salpa, that's what we're in the middle of training on today. We're training right now on weight loss stalls. Right now, I'm just getting caught up on some questions, but we talked about why it happens, and we talked about a little bit of the science of what's happening in the body. Coffee King, you don't need to worry about vision issues. If you have a history of diabetic retinopathy, maybe that's not a good idea. Talk to your doctor or talk to our clinicians. But generally, no, vision is not an issue. There's a lot of ridiculous misinformation that's being spewed. Any potential complication or side effect is going to be blasted on social media because guess what, guys? Super clickbaity. It's very trendy. Oh my God, I told you the GLP-1 medication is so dangerous. It's so bad. Everybody is dying to say it. Everyone's dying to scream it off the rooftops. They're going to continue to do this. It's the same thing they're doing with carnivore. It's the same thing they do with fasting. Guys, wake up, smell the roses. They don't smell too good because somehow that's a metaphor for what I'm trying to say, which doesn't really make sense, but you get my point. There's a narrative, there's an agenda out there, and the money is made when you guys stay sick. I mean, I don't know how many ways I can try to make it clear for you. Yeah, Kev, just shoot us a message. Kayla, is there a blood test to see the amount of inflammation? There is. There is. It's called. There's actually a lot. What we usually do is a CRP and an ESR. Those are really good tests to look at inflammation. You're welcome, Coffee. Hello, mom of twins. How are you? Rack, I've been told two different things. One, Ozempic is bad for your liver, and two, it's good for your liver. Ozempic is not bad for your liver. I don't know who the hell told you that. I mean, it's already been demonstrated very much like over and over. Uh, it's probably going to become, I mean, okay, let me take a step back. Non-alcoholic fatty liver disease, which is probably the most common liver issue. GLP-1s are literally showing to reverse that on its own without dietary changes. Anything that improves insulin resistance is going to improve um, liver issues, liver fat, non-alcoholic fatty liver disease. So um, it's more stressful on your pancreas. It's got some stress on your pancreas, some stress on your gallbladder. But no, for your liver, for your kidneys, it's been demonstrated to be very beneficial and helpful. No, Chris, we do those tests on you. If you're in my Warrior program, Chris, we would have already drawn your inflammation panel. So if you can text the medical team to send you the results. Conjam, I've lost from 188 to 120 on Monjaro. Is there a maintenance dose I should continue on? So Conjam, the thing that we always teach, the thing that we always advocate for is improving your health, improving your metabolic health so that you don't have to stay on a medication or a larger dose for the rest of your life. Working towards like a micro dose protocol, a micro protocol can be very beneficial. And this is one of the things that we strive for and that we encourage you guys. And quite frankly, this is what we do. We're going to get you on a lower dose. That's just what we do. We have a whole process of how we do that by implementing other targeted lifestyle interventions. All right, so the long anticipated breaking the stall, guys. If you just joined me, welcome, welcome. So my name is Dr. Jones. I have clinics we service across the nation, all 50 states. I'm going to get into talking about how to break your weight loss stall. So if you're just joining us, this is the phone number to reach out to my team if you want help, guidance, coaching, structure, support. If you're tired of just kind of winging it, we do service all 50 states. So a lot of you watching this are currently in a stall. You're struggling, and so here's what you got to do. Adding AOD can definitely help break the stall, but if that's all you added, my concern is you're just going to stall again. So adding another peptide, adding another medication to break your stall is not really the best or sustainable solution in most cases, not every case, because usually the primary reason why you're in the stall is because you're not eating enough food. So your metabolism has slowed down. So how do we speed up that metabolism so that we get it burning as many calories as it was burning before you stalled? That's the $1 million question. So step one, you need to figure out what your average caloric intake looks like. Are you averaging 1,000 calories a day, 1,200 calories a day, 800 calories? What are you averaging? Because it's low, but we got to figure out what you're averaging. Is it possible to ride out the stall? Sure, you can ride it to nowhere. Yeah, no, I guess you can't write it anywhere. That doesn't really make sense. So no, you can't write it out. It's not going to fix itself in probably 99% of the cases. So once you figure out how many calories you're averaging, you slowly increase that intake. So let's say like usually by 200 to 300 calories. So if you're averaging 1,000, just to make it easy, you're going to increase your intake and shoot for about 1,200. Week number 1, 1,200 calories a day. You can do intermittent fasting on the 7 days a week, which would actually be good so that you can start to lower your insulin levels. But you got to hit your calorie goals on all 7 days. Then week number 2, you're going to increase it again, maybe 1,400. Then week number 3, 1,600. Then week number 4, 1,800. You're going to slowly increase your calories consecutively, and you're going to pay attention to your body because a couple of things should be happening. Number one, you shouldn't gain weight. In most of the cases, you will not gain weight week by week as you are slowly increasing your consumption of food. How is that possible? Because your metabolism's speeding up. And this is like a concept that I think is challenging for many to kind of understand, but that is the case. Your metabolism speeds up slowly at the rate of which you are increasing your intake of calories. So there's a net. Some of you will actually, believe it or not, start to lose weight as you increase your intake of calories. That's always very interesting. That's always shocking for people. They're always a little confused too. They're like, wait, what's going on? How am I gaining weight? How am I not gaining weight? Or how am I losing weight, right? You're welcome, Delia. I wanted to make sure that you guys understand this before I hop off, because I am hopping off here in a minute or two. But you want to keep increasing till you hit a number that is near your TEE, your total energy expenditure. So that number is supposed to be the amount of calories that you could eat or should be eating on a daily basis. So, but your body, everyone's going to be different. So when you're working with us, we're paying attention to that, looking at the scale, looking at your symptoms, and making an educated decision on what's happening, and then giving you advice for the following week. Kev, this number does accept WhatsApp, but if you don't think your message is going through, you can shoot us a DM on the TikTok page, and then we can respond that way. So does that make sense, guys? I know a lot of you were struggling with the weight loss plateau. Now you know how to fix it. Now you understand the changes to your body. Make sure you're following me on TikTok, guys. Make sure you're following me on YouTube. Turn on notifications. I do go live every morning, very rarely in the evening, but I had some free time today. The reset is powerful. The metabolic reset, the medication reset. I don't have enough time to get into that today, but the medication reset is also another valuable and powerful tool where we take a break. We slowly decrease your dose and create a scenario for your body where you can resensitize to the medications. So that will also take place too as well if you're working with us. So that's it, guys. I got to run.